All right, so we're going to look at the bones of the pectoral girdle. Just a few hints. You should, when you're looking at bones, always identify whether the structure of that bone is on the anterior or posterior side. So get your orientation. Um, and the pectoral girdle, which we're going to talk about, is unique because it is not a complete bony circle, unlike the pelvic girdle. So let's look at the clavicle. So here's a superior view, um, and we call it the acromial end, the sternal end. So the sternal end attaches to your sternum, acromion to the acromial process of your scapula. And this is an inferior view, again, acromial end and sternal end. So we have the sternal articulation, which is on the sternal end, and we have the acromial articulation. And then we have the conoid or posterior tubercle. So you can see that on the inferior surface on the posterior side. The scapula. The scapula is a flat bone, and we're going to look at a posterior and anterior view. The easiest way to know if you're looking posterior is because posterior you have the spine of the scapula, which is very prominent. So we have borders. So superior border here in red. We have the medial or the vertebral border. So that's the border of your scapula. You can palpate just lateral to your spinous processes. And then we have the lateral or axillary border. Remember, axillary refers to your underarm. Also have angles, the superior angle. We have the lateral angle, which is by the glenoid fossa, and then the inferior angle. We'll clear that and take another view of the scapula. We have the glenoid fossa. That is where the humerus articulates. So that's the articulation between the scapula and the humerus, sometimes called the shoulder joint, but we're going to refer to it as the GH joint, the glenohumeral joint. Then on that fossa, we have the supraglenoid tubercle and the infraglenoid tubercle. We have the spine of the scapula. As I said, that's the most prominent structure that can indicate that you're looking at a posterior view. We have the supraspinous fossa. So that's above the spine of the scapula on the posterior side. And then, of course, we will have the infraspinous fossa, which is below the spine of the scapula, again, on the posterior side, as indicated by the P's. Then on the anterior side, we have one large fossa, which is called the subscapular fossa. And these are going to be the attachment points for the supraspinatus, the infraspinatus, and the subscapularis muscles, which make up the rotator cuff. Continuing with the scapula, we'll look at the views again. We have the coracoid process, which you can see both on the posterior view, but it's the most prominent anterior process. Then we have the acromion process. And if anybody had a separated shoulder, quote unquote, that is probably a separation between the clavicle and the scapula at this acromion process. And it's more posterior relative to the coracoid process.